Well, with all of our recent weather changes, you may have noticed the people around sniffling, sneezing, and not sounding so good. ABC 15 taking action, talking with the doctor to find out what you need to do to stay healthy this cold and flu season.
All right, 624. So a recent report out shows that Tucson and Phoenix, both of our areas, could see some of the highest flu cases yet this year. So right now we're taking action to try to figure out how we can all protect ourselves.
Yes, so joining us this morning is Dr. Mark Patton. Thank you so much for being here. We appreciate it. And we wanted to talk to you about some tips and things good to know about this upcoming flu season. So one, why might we be seeing these higher cases in our city?
There's no particular rhyme or reason.
Okay.
It just happens to be that we're getting more flu here than in other places.
Okay, interesting. And we know that different areas peak at different times. But let's talk about the flu shot. Is it too late to get it if you haven't? Because I still see drugstores advertising, we have the flu shot. Should you still get it? Is it worth it?
It's definitely not too late to get the flu shot. Right now, the flu is starting to peak, and it can peak as late as February, and it goes on all the way to May. So there's no reason not to get a flu shot, and now it's highly recommended for everyone to get a flu shot.
Okay, a lot of people are coming down with colds too right now, so I wanted to ask, because somebody here was actually, I don't know if I have the flu or the cold, how can you tell what the difference is?
Well, there are different symptoms. They're very similar. Both can have sore throat and coughing and make you not feel very well, but usually with flu you can get sick a lot quicker. You may know you're getting a cold over a couple of days. When you have the influenza virus, you can get sick very quickly within 6 or 8 hours. Plus, you usually have a higher fever with flu, and you can have other symptoms like muscle aches.
Okay. All right, doctor, so you brought some things that you want to show and tell. First, let's start with you. It looks like we're talking about germ control.
Yeah, prevention is the most important part of influenza. You don't want to get the flu. Once you do, you're going to limit it on your treatments, but the flu vaccine is obviously the most important thing. The other thing that you can do is wash your hands frequently with soap and water. Flu is transmitted by contact and by droplets, and so if you wash it off, you don't touch your mouth and give yourself the flu. You can also use hand sanitizer where there are higher concentrations of people with flu. At MVP Kids Care, I'll use hand sanitizer just to keep myself from getting the flu.
Oh yeah, every time I see it available, I'm just pumping some and kind of grabbing it around. What do we have here?
Well, this is a vaporizer or humidifier. If you do get the flu, you feel better if you have more moisture in the air when you're sleeping, and it can also help mobilize the secretions and prevent some of the secondary complications of the flu. So we recommend for all our kids to use a vaporizer or humidifier while they're sick.
Okay, we have about 30 seconds left. Looks like we have ibuprofen. Always comes in handy, right?
Naproxen, Tylenol. Those kind of things help you feel better. There's not a specific treatment for the flu in most cases. And then the other thing is hydration. You can use sports drinks or water. Drink lots of fluids is the most important thing. Even good old chicken soup can help you stay hydrated and make you feel better. Yeah,
these are like the classic
staples,
sick remedies for you here. My mom works at the hospital. I always tell her, if I hear push fluids one more time, I can't deal. Okay, well, very good. Thank you so much. We appreciate it. Hopefully all of us can avoid getting the flu or any kind of cold. If you have already had it, well, hopefully you won't get it again or spread it to anybody else. Thanks so much.
Doctor, thank you.